Hi, remember me? I'm Benita, the endocrinologist from far north Queensland in the previous video. Now that I've done all the prerequisites, it's time to register and connect. Let's get started. My clinical software is conformant with my health record, so I'll register via the conformant software registration process. There are 4 steps involved in this process. Firstly, I must register for a provider digital access account if I don't have one already. PRODA is an online identity verification and authentication system. It lets you securely access government online services. Once I log into PRODA, I select Health Professional Online Services, HPOS. HPOS is an online portal for healthcare providers to interact electronically with digital health services. Within HPOS, I'll need to link to my existing health identifiers. To link identifiers, I can either use my provider number or APRA registration. And then I can register my practice within HPOS. Now, I need check with my software vendor if they have been registered as a contracted service provider. I'll need to request and download a National Authentication Service for Health (NASH) Public Key Infrastructure (PKI) certificate. This final step is to link my existing Medicare PKI certificate. Now it's time to configure my software. As I follow these steps, I know I can seek guidance from my software vendor because their configuring may differ. In general, I need to install NASH PKI and Medicare PKI certificates within my clinical software. Confirm Healthcare Provider Identifier Organisation, HPIO, and Healthcare Provider Identifier Individual, HPII, numbers have been configured into software. Update permission settings for staff to access and check that it can now be accessed via my clinical software. If my clinical software wasn't conformant, I would need to access my health record via the National Provider Portal. Here are 3 simple steps to register for the NPP. Step 1 is to register for your PRODA account, if you don't already have one. Step 2 is to register your practice. Step 3 is to link your healthcare provider individual identifiers to your organisation. Thanks for joining me. I'm so relieved to be registered and connect to my health record. The time it took to register and connect was well worth it. I feel much more at ease now, knowing that in emergency my patients and I, as well as other healthcare providers, can access key health information in my health record. The RACP's My Health Record Best Practice Guide was helpful to me in this process. You can download the guide from the RACP website. Go to Fellows, Resources, and then select Digital Health. Remember to contact the Australian Digital Health Agency's registration and support team for any additional support you may need, or visit the website.